All right. Well, welcome everyone to the Three Principles Global Community webinar. The Three Principles Global Community, or 3PGC, is a nonprofit organization that is committed to bringing an understanding of the three principles as introduced by Sydney Banks to people throughout the world. And today we're so delighted to have Lyn McCright and Teresa Walding. They help nurses and health professionals unlock the power of the three principles to transform healthcare. Through coaching and mentorship, they show how understanding the mind-body connection fosters resilience, compassion, and insight, creating a holistic approach to patient care and personal well-being. And they do this by empowering nurses, healthcare professionals to create lasting change by integrating the three principles into education, coaching, and community support. So with that, I will turn it over to both of you. Go ahead.
Okay, great. Well, thank you so much, Tom. And we're just so delighted to be here with you today. If you can join us with your videos, that's always best. We get to respond to your faces as well as your names. When 2015 came around, and that's been a while, Karen Miller Williams and I got together and we realized that it would be a wonderful thing to have a community of interest for nurses and health professionals. So we started that. And at first it was just a conference call, and then it became a Zoom call. And that little group has continued even until this day. There's about 125 people in it now. And we are now taking the next step to evolving in our new entity, which is the 3P Healthcare Community. It's an international community. So it's exciting to have the opportunity to present to a much larger group now, and healthcare administrators, people who are coaches, people who are anyone who's working within healthcare is welcome to join this group. And I know the potential is huge because just for example, my own profession, nursing, is the largest profession in the world. We have 16 million nurses worldwide, 4 million in the United States alone. And just for comparison, I'll say that the second largest group of licensed health professionals are the physicians. And the nurses outnumber the doctors 4-1. So you can see how much larger we are. And all of the other health professions fall in smaller numbers: social workers, pharmacists, therapists of any variety, emergency medical technicians, and so forth. So anyone who is either a licensed health professional or works within the healthcare system is absolutely welcome to join us. And we'll be launching something entirely new for this group probably in January and getting it organized in December. So we're thrilled to be here now. It's been kind of a long road. Teresa and Tom and I were talking just prior, and it seems like what's happening now, our healthcare professionals are actually beginning to look. They're looking for themselves first, and then for their clients. Now, that's always been true. I know that some of the old tapes that we've listened to from Sydney Banks, he talks about that specifically. But I think in much larger numbers now, people are looking. And why is that? Well, in the profession of nursing, I'm most familiar with that. 27% of nurses left the profession over the last 3 years. Almost a third of us gone. So we have really got a crisis on our hands because many more nurses are reaching retirement age. Um, Nurses who are coming into the profession now often leave before a 2-year time frame. So continuing to keep the profession alive and working is really critical now. I can't imagine a world without nurses. I can't imagine that. So we're pulling together now to see what looks to us like obviously the answer. I remember some years ago there was a conference held in Scandinavia and again in Africa, the title of which was the same. It was described as one solution. And of course, that's how we see the three principles as one solution. And it certainly appears to us to be the solution for healthcare. In fact, Teresa and I have had the opportunity to present to many statewide and national, even global organizations over the last 8 years. And we've had a good response, but of course, there's always a question on the part of the conventional health, healthcare system about how the principles really work. And we have taken it into our hands to actually present a certification program through the American Holistic Nurses Credentialing Program that certifies nurses who want to be coaches, because the focus now will be health promotion. And nurses can choose to either become certified or not if they want to take the test. And beyond that, we are even offering our own program online to the doctoral nursing students at Texas Wesleyan University. So they're coming into our course as well. And what do we teach? Only the principles, just the principles that Sydney Banks presented to us 50 years ago. So it's a big celebration for us to be bringing it professionally to organizations such as the American Public Health Association, the Texas Nurses Association, Texas Nurse Practitioners Association, Nurseology, American Holistic Nursing Association, on and on. But we are still coming now to creating within the principles community a much larger group than the 125 people that we have in our original nursing and healthcare community. It's just a joy to be here now doing this. And I want to turn it over to Teresa really to talk about what the future looks like to her. But I'll say one thing first. When we began, Teresa and I, we had two goals. The first of which was to bring new life to ourselves and our professions. And the second was to bring resilience to all of humanity through the health professions. Teresa?
Thanks, Lyn. You know, it's been such a joy for me to learn that there was even principles to begin with. You know, most of us, I think, if you think back to like the first time you heard about it and you went, what? I don't get it, right? Like how can something so small have such a big impact? And the first time I heard about principles, Lyn and I were in a car coming back from one of our conferences, and we wanted to really, I guess it's just the nursing way. We want to think of something that's going to help people in a bigger way, because for me, I was tired of seeing the same people come back over and over and over. And every time I would take care of them, they were a little bit sicker. And some of them really found this joy in the midst of their journey. I took care of one man every time I went to get him ready for his next surgery. He would be laughing and joking. And finally, I just asked him, I said, what is it? I mean, how do you do it? And he goes, you want to know the secret? I woke up today. It's a really, really good day. And he said, and his wife chimed in and she said, don't let him fool you. He's been this way his whole life. He saw the joy in life his whole life. And he told me, he said, I have no regrets. And I've always been one of those people that took whatever wisdom pieces someone wanted to give me in my nursing career. And I learned really early on to listen to people with more wisdom than me. And he was one of those people. One of the jobs I had was the head nurse of a skilled nursing unit in the hospital. And they're very free with their advice, their knowings, what it's like to get older. One of my patients, she goes, you know, if I can tell you one thing, stop worrying about everything. And I was like, well, that's a nice thing to do. Well, I didn't know that years later, her words would ring more true to me than I ever imagined. When I got caught up in the cycle of worrying about my husband, worrying about my daughter, worrying about my career. And suddenly I didn't want to be a nurse anymore. And I thought, I just can't do it anymore. I'm tired. I want this to end. And that was the weekend I learned about the principles. And I went to that conference fully intending on Monday to quit my job with no plan. You know, when you get to that point where you just don't know what else to do. And I learned how my thought works. And I learned the inside out nature of life. Now I wasn't, that wasn't something new to me, but the way that the Dr. Blevins was our speaker that weekend, but the way that he laid it out and the words resonated with me because they said, don't listen to the words because what you want to hear is what's beyond the words. And for some reason, that was an easy switch for me. And when he started talking about flat earth thinking, like thinking things work in a way they never worked, I was like, I wonder what's here for me. Like that, those fleeting thoughts that go through you. And when he talked about separate realities, like the whole world opened up. Like I just knew. I knew this was what I had been looking for. I knew it was the answer to the goal that I had written at least 15 years prior to that conference that said, I want to find something that helps people stop suffering, even in the middle of the night at 3 a.m. when you don't know what else to do. And this was it. Like my mind got so quiet and so present. I had never felt like that before. And it was like, there's just some things you just know are here for you. They're here for you to either take the reins and do something with it or just use it for yourself. And both are fine. But on Monday morning, I knew this was for me for the rest of my life. To help people stop suffering from this direction has been the most profound healing I have ever seen in my life. And it's funny because, some things are here for you and some things are here for other people. And I was going through YouTube the other day and there was a little clip, and I wish I could find it again. And it was talking about Prince. And he said he woke his band up in the middle of the night. It was 2 a.m. and he had a song in his mind and he wanted to record it. And they're like, no, dude, no, let's just do it in the morning. And he goes, no, if I don't do it, Michael Jackson's going to. And he just knew that it was there for him. And he took the reins and he created Purple Rain. And I thought, oh, me too. And I bet everyone here has had a moment like that where it's like, me too. It's here for me. I've seen something that I need to share and I can't help myself. And I want to share what I have to give to as many people as I can touch. Because when you find something that's personally helpful for yourself and you help people see it for themselves and you've given them a gift for the rest of their life, it just keeps on giving. And people resonate with it. And I know we're finding each other now. I know we are, because I've connected with more people outside of the realm of nursing, outside of myself, who hear something that says, yeah, me too. I want to help people heal. And all of us are welcome to do that. Which brings us to our most recent adventure. In 2019, I decided I wanted to create an app. I didn't know what it would look like. And well, I did know what it would look like. It would be only 3 principles on the app. And it would be a way for us to connect more people to this understanding with as many people who wanted to help people see that. So I did a Nurse Hack for Health. It's a program where nurse innovators, sponsored by Johnson & Johnson, DevUp, a company called Sunseal, which is a nursing science leadership society. Anyway, they sponsored this program. So as blind as I could be, have never written a pitch in my life, envisioned this app, and I did a pitch in a day and a half of something I had never tried before. And I was like, oh, this is it. Even though I didn't know what I was doing. And even though I can't say I did a bad job, but I could have done a lot better had I not had some knowledge, right? And so Lynn and I did one the next year, and we actually got to talk to several people, and they were like, I really love what this is, but I need you to put it in a package and tie a bow on top of it. I didn't know how to do that. And I was like, because we all know that the principles are a little hard to you can only do it through real sharing, like real connection with real people. And the feeling of understanding or the clarity or the insight that we talk about isn't something that seems to be easy to impart on someone else. They just have to see it for themselves. And so we kept moving forward until this year. And in May, I found a couple of young app developers who are creating something for us. Well, it's for them. We're just going to be on the platform that will actually bring the principles to the masses. And so many things have come up about that. Like any practitioner who wants to be on the app can be on the app. Any person who just wants to use the app for their own personal growth and development can do that. But beyond that, I had this vision. How many of you have seen the Modelo study or read the book? Do you know what the Modelo is? By Jack Pransky. It was a project done in the 90s about Homestead Gardens and Modelo and the results of that project. That book was something else for me. I was like, that's nursing. That's where we can really go in and help people. So I called Jack, and I called Alan Flood, and I called Tom Kelly, and a few other people came out of the woodwork, who was at Rob Cook and Risa Ray. And we're actually applying for a grant to do a Modelo-inspired project through the app, because the research grant is marrying technology with real people and research. And the foundation of it will be the 3 principles. I have no idea what that will look like, but I do know that it's never existed before. And we want people in the 3 principles to be part of that, whether it's your own practice or supporting the work or helping us envision what that might look like. It's not a one-person project. It's an everybody who can see this vision project. And I know I've left a lot out, so Lynn, maybe you can clean up some of the pieces.
So one of the pieces is that it just so happens that the zip code area around the Texas Wesleyan University, where our program is offered to the doctoral nursing students, nurse practitioner students, has the highest infant mortality rate in Texas. So the university, Texas Wesleyan University, is collaborating with the people who created the app to write a research project. And that research project is actually going to a private not public, but private source in Europe. And it's actually due, I think, next week. So it's a very short time frame, but we'll hear back, I think, in January,
April.
and then it'll start in June.
September.
The the project is in a way is huge because that area has lots and lots of young people, primarily Latino and Black, and they have lots of young children, and we're excited about the opportunity that this will provide for the nurse coaches who we've educated through their program at Texas Wesleyan to work with the community directly, include and other people as well. But we've had, I think, about 50 students now that have gone through that program, and some of which have become certified nurse coaches, some not. And but they've all had the course. It's actually a required course through Texas Wesleyan University. Introduction to Nurse Coaching is what it's described as. When Teresa and I attended the conference that Dr. Blevins spoke at in 2015, what we heard was that the joining of nurse coaching together with the principals would be a huge way for the principals to be brought to the profession of nursing, and certainly now beyond nursing. Nurses who want to sit for the certification can do so through ahncc.org. And if other health professionals want to take the same course with us, they can receive our health coach certificate of completion. So we are CE providers, continuing education providers, through the Board of Nursing State of California, and licensed health professionals are required by their state to have so many continuing education hours, and those have been few and far between for people who are interested in studying about the principles. And we have now the availability of our 60 to 80 hour coursework to provide that, in addition to some other smaller continuing ed programs that we offer from time to time. It's been just a wonderful adventure. I do want to say that nurses have always been involved in the principles. As long ago as 1980, I had the opportunity to hear Sid speak at the Mailman Center, which is at the VA hospital in Miami. And there were a group of nurses there, about 5, that worked with Karen Miller Williams in the intensive care unit. And as they grew in their understanding, they scattered and went to different specialty areas. But nursing has always been involved. And of course, there were several counselors, psychologists in specific, who went to Salt Spring Island to meet Sid shortly after he had had his experience of enlightenment in 1973. So here we are, we're celebrating the 50th anniversary. And I was so inspired when I met Sid. I just immediately heard that this was for nurses, and was very fortunate to establish my own private practice of nursing in 1986. So it's been a number of years that I've been working with it, but we also just owe so much to all of the other health professionals. So I'm thrilled to now be launching into the 3P Healthcare International community.
I'm excited. I think there's so many of us out here who just want to help people and do the work. I think one of the things I forgot to mention about the app is it's also a wearable device, just like a Fitbit or a Garmin, where it can actually help you with your biometrics. your blood sugar, heart rate, sleep. I can't even remember all the things that it does at the moment, but it can do a lot to help us to recognize our stress patterns, our stress levels, and interrupt those patterns, in my view, with the principles. Like when you help someone see how stress is created and how we actually experience life, we have an opportunity to really have a very different conversation with people. And the app is actually designed to connect people on the platform with healthcare professionals, a nurse coach, a fitness provider, a counselor, a social worker, anyone who has knowledge that that person is seeking can actually be part of the solution to bringing these principles into people's lives, because we know how transformational it can be. And, so whether you want to actually be the provider or you just want it for yourself to connect with the larger community, I think there's benefits for both. The one thing that in the future with technology, human connection will be a very, very high resource because we crave it. We want it. We like to be in other people's presence, in their company. So I actually see it in a way like bringing people who are using the platform or using the ring to help with their health and well-being, building communities within their community. So you can connect with each other and create these healthy communities that we keep talking about. There's a lot of resources and a lot of knowledge, but it's so disjointed and fragmented. There's not really a good place to help people get accurate information. And this app can be one of those places to really be a resource for people. And for the larger Three Principles global community as well. Can you imagine if we were all on the app, driving the conversation within the communities on the app, how much natural sharing and connection would be happening that would allow us to have those, off app, off camera conversations that really do help people heal. I don't know. To me, it seems like the best of all the worlds, since, virtual reality is not going away. It's only getting bigger, as evidenced by my husband loves to play on the virtual reality glasses. He has friends in there and everything, and I watched lectures inside the virtual reality glasses, and it feels like you're there. And I think this is where our children are living. This is where a lot of people are finding friendships they never found before. I hear them talking and actually having conversations with each other. And I don't think a lot of people think that that's a real life experience, but it is. My daughter did it 20 years ago. She was 21, well, 15 years ago. She had been playing video games a lot. And one day she goes, I'm going to San Antonio with my friends. And I'm like, I don't see any friends here. Where are they? And her friends came down from, I think it was Massachusetts or somewhere. And somebody lived in San Antonio and she lived here. And they all met for the weekend. And she had the time of her life. I was like, you don't know these people. She goes, yes, I do. I've been talking to them for 4 years. And they're still friends 15 years later. So I know that you can build relationships through a virtual reality that feels every bit as real as someone right in your house, and maybe more so. I think sometimes we're a little more honest in those places than we are right in our own home sometimes. So I think we have to embrace the future of what it's going to look like, in spite of sometimes our own beliefs. Some people don't think that you can build those kinds of relationships unless you're right there in front of the people, feeling their energy and getting that. And I think there's some truth to that. But where that's not the norm for most people, I think this is a really nice way to help connect people. that maybe we could meet in person and have those relationships again.
One of the things that's really exquisite about the app is its ability to actually detect anxiety before it appears. Now, that sounds almost magical, but the way it works is that the physiological signs of anxiety don't appear until about 5 minutes after the sensor will pick it up. So all of the people with health anxiety now are going to be so benefited with knowing that one thought changes everything.
Yeah.
Another part of it is that the community is going to be um, utilized for the research project for 5 years, but afterwards it'll be, of course, on its own. So part of the project will be working with community members within the social organizations and churches and supporting agencies that are already there to provide a safety net for the community to carry on the work even after the 5-year project is concluded.
Well, and after it is concluded, be replicatable to be done in other places. So that's one of the goals of the grant, is that we can scale it or replicate it in multiple places. So that's the goal, that's the desire. We're going to try. That's where it's at.
We've had such wonderful success with our students, and it was just remarkable. We were talking to the director of the um, doctoral nursing student program the other day, and she said that one of the students had come to her and said, when I was in the course, I could not figure it out. I could not understand what they were talking about. And she said, now here I am, I'm graduated, I'm out, I'm working, I use it every day, she said. So we know that it has an impact. And we've just had so many glowing reports from students whose careers have changed, whose personal lives have changed. And we're currently working with one of the faculty members to bring it to their program herself. So we're educating the next level of teachers and within the profession. So that's for us to actually be acknowledged as leaders within nursing is in a way such a gift. I'm thinking about the Texas Organization of Nursing Leadership. We actually presented a 3.5 hour half-day pre-conference to that group. And it what they said was that they put it to work on Monday. So thank you.
So I'd just like to open it up for questions. Anyone have questions about the app, our work, your part in it, how you would like to be a part of it, any of those kinds of, or whatever else comes up.
My area is public health, so this is very close to my heart. Hey, Tyson, how are you? Thanks for coming.
How exciting. I haven't put a million questions probably, but is the app available now?
January 6th.
January 6th. Okay. And how do you get involved as a provider and yeah, how
I'll
do you
take your name and we'll do a presentation. You can come hear all about it. And if anyone else wants to come, anyone's welcome to come hear the presentation. You don't have to be just a health provider. Just come find out what it's about, what we're doing, ask your questions. So yeah, that's how you do it. Is Alex Bridgen is the CEO of what's called Hive Health, hivehealth.io. I can drop it in the chat.
Yeah. Okay.
Be gentle with the websites. They're getting professionally redone at the moment. So, but there's enough information for you to see. They also have a public profile that when you come to the presentation, they have like all the research papers, anything you want to know about the company, they will send you the file.
Oh, there's been a huge amount of research done on the app itself and all of the technology behind it. So we haven't begun to touch all the professional papers that have been written about it, but but they're there.
And then what about sharing the app once it is released? I'm wondering, so I work at a fairly big hospital in Minneapolis, and I'm part of the wellness committee there now. And I'll be sharing next year in like a 30-minute wellness, whatever. And then we also have monthly meetings as well with the whole nursing staff.
Wow.
They're all invited live, and those are live sessions now. That's a new program
Amazing.
that we just started. So I have so many opportunities now to share, like all of a sudden these things are coming up to share the principles, and now with this app, I'm curious
I think
about that.
the app could be like your hub of connection. Like if the hospital wanted to use it as part of its wellness program, so that everyone can do their own biomarkers, right? Biomedicine is the up and coming thing. I mean, there's even going to be you can do an eye exam and a dental exam through an app now, and we're looking at partnering with those kinds of resources. And so it could really be a place where people can access information about what it is they're interested in. Doctors could be on the platform if they want to run their practice through the platform. And the potential is unlimited. If you can think of a way that an app would help you, your practice or business, you can do that. It's designed at the moment to take on about 10 million people.
Have you talked about white labeling?
I'm sure Alex has thought about how white labeling, but it's so new right now that we can make it anything we want, which is why we wanted to bring it to the Three Principles community. Because we know that health starts inside. Health is already there. Most people just don't know it. They're caught up in their outside in thinking, and they're like I was. I've tried as many modalities as you can imagine to help myself feel better. I spent a lot of money learning to do all these said modalities. Nothing healed me like the principles did. Like when I found the principles, I stopped looking. I literally stopped looking. I knew I found what I was looking for. So if you can imagine it as far as bringing your staff together or the people together, you could even trial it at your hospital, do a trial, 15, 25 people, and see what it's like. See if it does what you want it to do. But like I said earlier, it's almost like have you ever been on the neighborhood app? Like, okay, so it's kind of like that. Here's all the people in my neighborhood and they all live all around me. So when something happens, hey, I'm 2 streets over. Okay, do you see my dog? How many dog things do you get, right? But we could do that by checking on people. Hey, I noticed you haven't been on here in a couple of days. What's up with you?
Yeah.
You see how it humanizes us and says, oh, somebody noticed that X, Y, or Z has happened.
Yeah.
And we build those communities of people we may not know well, but we know well enough to bring that sense of community back. We've lost that sense of community. People who, maybe don't belong to churches anymore, or I don't know, anything you can imagine, sports teams. We grow up, we change, our friends change, life changes, we join different groups. it can do all of that. The one thing I think that we're really missing is the wisdom that older people bring to the younger people. And we could be sharing that in a very non-judgmental, non-threatening way through the app.
Yeah. And I like how you talked about embracing the technology, because I've always been a little bit resistant to it. And I'm curious, you were talking about the biomarkers and how it can detect stress before you feel it or something,
5 minutes.
and then you can interrupt it with the principles. Can you talk a little bit more about that? Like, what would that look like, interrupting it with the principles?
So the foundation is actually AI, which some people go, oh, hold on, AI, it's taking over the world. That's not true. Well, it is true. It is taking over the world, and you're using it everywhere you go. If you use Grammarly, you're using it. If you use your phone, you're using it. But this particular AI is really designed to be more like a co-pilot or a friend that says, "Hey, I noticed your heart rate variability is changed up a little bit. You want to check in and see what's going on." And what it does is it starts collecting the information based on what the end user, the person using the app, says about what's going on with them. And so what happens is you get to start seeing your personal patterns of what stress might look like for you. Oh, every time I have this happen, I have a panic attack. So what was happening the 20 minutes prior to this panic attack? Have you checked in with yourself? And teaching people to notice their thought in the moment, because we don't think about it. None of us were ever trained to notice that. And so the questions will be reflective questions that help a person figure out themselves. And the only thing the AI does is collect data and patterns. It's good at pattern recognition and can give you a suggestion. The initial suggestion sounds more like a Band-Aid, which we know it is, of like, hey, I see your stress levels going up. Maybe you should stop and take a deep breath. Maybe you could do a meditation. Maybe, you said this helped you last time. Maybe now's a good time to try that. Now, it's not going to tell you to go sit and do it for an hour and a half. Sometimes just alerting you that that's happening, you'll have an opportunity to change your mind. Not and a caveat, not everyone will want this much detail for themselves. So the features can be turned off and on. You don't have to be like checking in with yourself every 5. Oh, I'm feeling this. Let me check my app. That's not the intention. It's just a guide, like signposting to a live person who you can connect with, whether it's coaching or counseling or whatever is needed. But as people get used to, and the other part that will be on the app are like programs, like you can take a course, you can listen to a podcast, any kind of content creation, especially 3P content creation, can have a place on the app so people can be exposed to it. And based on the person's personal profile and what they like, those will be the recommended things that they would access to help them with their mental and physical health. Did that answer your question?
Yeah, it does. Another question that's coming up is, I don't know how to word this. When we first learned about the principles, like, it made perfect sense that our thought creates our experience. But then I turned to trying to control my thoughts immediately, because that's what I was used to. And I'm wondering how this is different than trying to have any control. Like, it monitors you and then it tells you not what to do, but how do we move people away from relying on it and focusing on life?
It's insight. So all the prompts, in my hopeful view, will be pointing to insight. Like, what do you make of those thoughts that you were just having?
Okay.
Very open-ended.
Yeah.
Not suggesting what to think at all. Like, one of my goals is to have like an introduction to the principles course. I can't make everyone take it, but I would like something that, however, it hasn't been done yet, so I don't know what it's going to look like, but having a way, and again, anyone who's in the principles who wants to do this can, because we all have a lot of different ways that we teach it or talk about it.
Right.
And it's all necessary, and everything that we put in, the AI will know. Like it's a data bank of information. And we know it will be imperfect, beautifully imperfect. And it will be fine, because whenever a person, individual, hears truth, don't we hear it the same? You can't change truth. So this is the beginning of something really big, and I have no idea what that will look like. I just know that the three principles have to be a part of it.
It's very exciting.
It is.
Yeah.
And
Yeah.
and it's fascinating, and it's fun and easy. There's an ease that happens, I think, when you're in alignment with what I guess your purpose is. But what's funny is it's not just me that finds it easy. Other people do too. And I think it's a very important conversation to have. And it's not about one person. It's about the collective consciousness, if you will, of people finding people. Like, I have no idea how I met you, but I'm sure glad you're here, right?
Well, and that's one thing about the ring. I mean, we have so many other technologies available now, such as the Aura app, for example. There is no human connection with the Aura app. It's all technology exclusively. This provides an opportunity if someone chooses to be coached.
Yeah, I love that aspect of it. I know the other organization the other hospital system that I worked for was working on some kind of fitness app or something like that, but there was no human connection to it. So I
Right.
love that piece of it. It's great and so needed.
Well, yeah, that's the thing about technology is, it cannot do critical thinking or human connection. Both of those things are impossible with technology, but with human beings, it is. And we need each other. It's what makes our lives feel complete, is when we have people to share it with. And I know there's plenty of people. My daughter probably is one of them. I don't need people. I think you do. Because who do you call when you need somebody?
Mama.
Might be me. So, when we get into trouble, whatever that trouble might be, we reach out to the nearest person who loves us. And
This is such a huge advancement in healthcare potentially. I was looking at Sid Banks' first little book, Second Chance, the other day, and in the forward or in the dedication, he wrote that, and this may not be the exact wording, that it would his hope was that it would help alleviate some of the needless human suffering. Man, let's just eliminate it all. It's like what's needless about human suffering, all of it. This app is potentially going to even let people know, women know when their menstrual cycle and ovulation is occurring, so that they'll know when they're fertile and when they're not. It could prevent unwanted pregnancies. And we were talking to somebody the other day with healthcare, federally qualified health clinics. There's 17,000 in his state already. And we want, the goal here, as I see it as a public health person, is to be able to provide healthcare at a very reasonable cost to the largest number of people. And potentially this could do that. This could be part of that picture. We were talking to a nurse, one of our students the other day who lives close to this community where the grant is being written for. And she said that there's so many young people, it's a case of babies having babies, really. And she said one of the most critical factors is that those young people who are parents are competing for the attention of their parents, competing with their own children. I want my mom's attention, but my mom wants to pay attention to her grandchild. Wow. It's needless human suffering. And I just have so much hope for where this is going for a very, very large population. There will be some people who can't wear the ring. There will be the end to the experiment. The project will be over, and hopefully the community will pick up and continue to work on its own. And it's the only thing that is lacking now is imagination. I mean, it's already begun, but it can go anywhere from here. It literally could go anywhere from here. So we're just on the leading edge, and it feels everything that Teresa and I have ever done in the last 8 years there's been no footprint for us to follow. We're always on the edge. It's always no model. There's no model to follow. And here we are again. It's starting at the very beginning with this, and we just see huge potential for the profession of nursing because it's the largest profession, and all healthcare providers, because all of us are needed to interface with the public now.
Can I ask another question?
Yeah.
Does anybody else have questions? I feel like I'm hugging.
You're doing great, Tyson.
The healthcare system the model is all about money. I mean, they're there to make money, and this almost seems to threaten that. No. And that's anyway, with sharing the principles within the healthcare system. First of all, at first I was like, I need to just get out of the healthcare system. And now I'm learning how to integrate my services in the healthcare system. But one of the fears I have is that they're going to see that this is going to reduce the need for their services, and then they're going to be out of money. But I know that's probably not true, but if you could speak to that too.
Number one, I don't know the answer for sure. This is my own thoughts about it, right? I think the first hospital system that embraces the principles will be the most profitable in the world, because you'll have healthy, happy staff and people who want to go to their services because of the healthy, happy staff. And when we teach our society to be healthier, okay, maybe we don't do as many surgeries, maybe we don't have as many admissions. So then we shift our perspective to health promotion and prevention, and people will come in droves to get that. We don't want to die early. We would like to prevent what's happening to us if we possibly can, if we even know what to try to prevent. And I think they'll save so much money in turnover and lost days at work and productivity that it will be worth it. So you create healthy, happy culture in your hospital. It goes over onto your patients. And guess what? Human beings run hospitals. And if anyone who runs a hospital who does not want to be healthy and happy and enjoy their life, I would say, I don't think you're human. If you have, I don't know anyone who doesn't want that for their life. And I know we get caught up in the money wheel, but we have to reimagine what that might look like. People are doing it all over the place. Fort Worth became a blue zone. I don't know if you know what that is, but it's a place. Yeah. So they became a blue zone because so much of their community aspires to healthy food and exercise. And so we're doing it on multiple levels. A friend of ours who's a nurse in a little town called Mineral Wells, they wanted to be a blue zone. They're about an hour and a half west of Fort Worth. And when they found out how much it costed, they suddenly became a wellness destination. But they're trying to create that community of healthy living. Well, guess what? People are tired of being sick. We want to be healthy. And again, my vision is that this app would be a piece of that puzzle that could connect people to other people who want this for themselves. I don't know. As far as in your hospital, it would depend on the points of view of the people in charge. Get one or two of them under your belt and watch how things change.
Well, everybody's talking about transforming healthcare now, and it's quite a broad conversation when you look at all the social media on LinkedIn and Facebook and the webinars that are being offered professionally. But nobody realizes that it's Teresa and a bunch of nurse coaches with a ring that are going to change the whole picture.
And not just us by ourselves, everybody. You know. And I think the other thing just to keep in mind is we're not in charge. Like that part of us that wants to like worry about, you know, what will people think and the healthcare system, and we're not here for that. We're here to help people, individual people. And when we keep our focus on that, I think we let the pieces fall where they do.
Well, and the healthcare leaders themselves are so appreciative of learning about the principles. We've had several students who've been at the top of the heap as far as their professional leadership. And this has helped them so tremendously. I talked to one of them the other day, and she said, Lyn, I don't worry. I don't worry. That's just huge, considering the position that she's in, very responsible position in academia. My goodness, I don't worry, she said. Music to my ears.
I know you had more questions, Tyson. Anything else coming up? We have about 2 minutes.
I don't think so. I just loved that reminder that it's not up to us. And as far as the healthcare system that I'm in now, the management is interested in what the nursing staff has to say because they see that we have to discharge patients by 11 o'clock and 2 o'clock, and nurses are rushed to get these. They can't give proper education, which is like the biggest piece of discharging a patient. Mm-hmm. And so they're stuck feeling pretty crappy about giving these people bad discharge instructions. And the upper management is cheering them on for getting these people out by these times. Yeah. And so they're just torn. And upper management had no idea what the pressure that they were putting on it. So we've had that communication between them now. And so I know that they're open.
Yeah. Yeah. I remember those days. I used to do it at night.
Yeah. I work in mental health, and so it's a little bit different. We don't have that. Yeah. Because of the emergency room and everything, but yeah.
Well, again, technology being AKA the ring could be a place where individuals could actually talk to a nurse about their discharge instructions. And especially after you go home, isn't that when you have all the questions? Is when you Absolutely. Get home, it's like, I've just been through this thing and I finally can think clearly, and now I don't remember anything they said.
Because when you're leaving the hospital, all you want to do is get home.
That's what, you're not listening to the what's next. And so it's a really nice bridge, I think. Yeah. If a hospital system wanted to include the community, it could be another potential avenue for revenue. Yeah. To be able to, and people are doing it. They're doing the post-home care part of that. So I'd love to speak with you more. And
Yeah, let's do that.
Anyone who's interested, I'm happy to have that conversation with you. Put your contact information in nursecoaching.com and or drop it in the chat here or email me anywhere you can find me.
Okay.
I'll give you my email here real quick before we go off, and then you can.
I'm really excited about the future of our international healthcare community and our opportunity that is here now for us to help alleviate human suffering. That's our goal.
Yeah, that is so wonderful and so exciting to hear what you're up to and just the truth and love that come out of everybody here on the call. And it'd be nice, speaking for myself, to get an update next year.
Yeah.
So we'll hope to see you again. And before we sign off here, I just want to tell you all about the next webinar, which will be in, now I'm doing this from memory because I lost my Google Doc, but I'm pretty sure it's going to be Tuesday, December 17th, usual time, 2 p.m. Eastern. And it'll be Dr. Mark Howard, who's always amazing and love to be
I
around.
like him. Yeah.
But until then, I wish everybody a beautiful day and see you all again next time.
Thank you
you,
so
guys.
much, Tom. And
Thank
thanks
you,
to
Lyn and Teresa.